Pediatric echocardiography requires a specialized approach due to the high prevalence of congenital heart disease and the need for high resolution imaging in small patients. Unlike adult echo, which often follows a standard sequence, a pediatric study must be comprehensive enough to rule out complex structural anomalies. Here are the 5 key views and essential tips for beginners. Subcostal view or subxiphoid view. In pediatrics, the examination often starts here because children have more compliant abdominal walls and a more horizontal heart position. The subcostal window provides excellent clarity. Abdominal situs, liver and stomach position, interatrial septum. That's the best view for ASTs, and IVC and SVC drainage. Both the vena cava can be seen in subcostal view in children. Use the liver as an acoustic window. This view is often the least threatening to a child and provides a roadmap of the heart's orientation. Parasternal long axis view is obtained by placing the transducer at the left sternal border. The classic view of the left ventricle, left atrium, mitral and aortic valves is seen in this. It is essential for assessing left ventricular contractility and checking for ventricular septal defects. You should see the right ventricle at the top, interventricular septum in the middle, and the left ventricle at the bottom. From the parasternal long axis view, if you rotate the probe 90 degrees clockwise, parasternal short axis view is obtained. This is a sweep from the base to apex. At the base, the Mercedes-Benz sign, or rather the inverted Mercedes-Benz sign, is seen when the aortic valve is in the closed position. The leaflets appear like that. Then you can see the origin of the coronary arteries, a critical part of evaluation of pediatric echo, especially in suspected Kawasaki disease. Sweeping down to the papillary muscle level helps assess LV function and D-shaping of the septum in high right-sided pressures, right ventricular pressures. Apical 4-chamber view can be obtained by placing the probe at the point of maximal cardiac impulse pointing upwards. All 4 chambers simultaneously seen in this view. It is the gold standard for comparing the sizes of left and right sides of the heart and assessing the tricuspid and mitral valves. For Doppler, this is the primary window for spectral Doppler measurements, example inflow velocities, because the blood flow is most parallel to the ultrasound beam here. For imaging, 2D imaging, you have to have the structures perpendicular to the beam, and for Doppler, the structure or rather the flow should be parallel to the beam. For suprasternal notch view, the probe is placed in the suprasternal notch with the child's head tilted slightly backwards. Aortic arch and its branches can be seen, and this is a reliable view for detecting coarctation of aorta and patent ductus arteriosus. Place a small roll under the child's shoulders to extend the neck. This opens the window and makes imaging much easier. Here are some tips for beginners. Hold the probe like a pencil. Do not grip the handle high. Hold it close to the head or the footprint of the probe and anchor your hand gently against the child's chest. This prevents the probe from sliding when the child moves or breathes. Use the correct transducer. Use the highest frequency probe that allows you to reach the required depth. In neonates, 8 to 12 MHz high resolution, low penetration probe is preferred. Older children, 5 to 8 MHz probe can be used. Larger adolescents, use 3 to 5 megahertz probe. A crying child makes for a difficult scan due to tachycardia and lung interference. Lung does not permit ultrasound to pass through to the heart. Everything will be white. Use a tablet with cartoons or pacifier for infants. Cold gel is a common trigger for crying. You have a gel on the echo probe. Always use a gel warmer so that a warm gel will not trigger crying as much as a cold gel. If the child is scared, perform the subcostal or apical windows while they are sitting in their parent's lap. And if you can have the child sleeping, that's also good.